I had my baby the day Ban Ki-moon, my UN Secretary General, is here, and I had a handshake with him. So far, they've named her Ban Ki-moon.
Half the world are women, and too many women die and have illnesses related to being pregnant when we know what to do, when to do it, what it costs, and what the effect is.
On September 25th, 1990, about 33,000 children under 5 died. Today, about 19,000. In the same period, we've cut maternal mortality by almost half. That's huge progress, but still not enough.
The global strategy for women and children's health is a vision, supported by a plan of action, initiated by Mr. Ban Ki-moon, the Secretary General of the United Nations. This is the right thing to do, and it is the smart thing to do.
We have the opportunity to change the course to stop this needless death.
Every woman, every child is an unprecedented global movement to change one of the most fundamental, unacceptable realities of our time, that hundreds of thousands of women are dying in the process of giving life, and millions of children are dying before their 5th birthday.
That is why United Nations has adopted a global strategy for women's and children's health.
To bring a focus around the women and children around the world dying of preventable diseases.
Possibly as many as 1/3 of all child deaths are associated with poor nutrition.
We visit homes and we talk to people, and the people were very happy that those services were next to them.
This year, a promise renewed, a new movement in support of every woman, every child, has now gained almost 150 governments, many hundreds of civil society organizations and faith-based organizations, all of whom have signed pledges to work to accelerate that progress.
Every woman, every child is a central part of our HIV response.
Investment on women and girls is, to me, the most important investment one could make. An educated woman is going to make an educated nation. Empowered women would see to it that the nation is empowered.
Government has realized the issues, and many programs has been initiated and delivered, not only making quality service available, but making it accessible.
The smile on the patient's face, that's what, the best moment in a doctor's life.
When the Secretary General met with business leaders, with federal governors, with health workers, there was a real sense that the global strategy is achievable.
With regard to the Millennium Development Goals that underpin every woman, every child, I don't believe that the goals can be achieved without the involvement of the private sector in a true public-private partnership.
Private sector has heard the Secretary General's call.
From government, from civil society, from the research community, working in support of this effort. Building platforms in countries, agreeing on strategies.
We can and in fact will be able to save the lives of over 16 million women and children.
We know how to do it. We have the means to do it.
Well, I have tall dreams for her. I've read about Florence Nightingale, and I would want her to do the same. I would want her to touch lives positively.